globally, healthcare is responsible for about 2 gigatons of carbon dioxide emissions. And that doesn't tell us a lot either if we don't know what a gigaton of carbon dioxide is. Well, it's just under 5% of the global net emissions. So 5 out of every 100 tons of carbon dioxide in the atmosphere comes from us as healthcare professionals doing things to patients to make them better. So in doing things to patients to make them better, we're making our planet sicker. And if we bunged all the healthcare across the world into one country, we would be the 5th largest emitter in the world. Or another way of thinking about it is coal-fired power stations. Now we're all trying to move away from fossil fuels, but healthcare is the same as burning 514 coal-fired power stations 24 hours a day, every day of the year. And where does this carbon emission come from in healthcare? Well, about 50% comes from the stuff that we use, the medicines, the devices, the medical devices, and the other goods like PPE that we use in our everyday practice. And about 25% in the NHS in the UK comes from our medicines use.
There are multiple things to consider here. The first one is make it data-driven. So what I mean is that you need good quality data to be able to, be confident in your research, in your interventions, and any potential thing you're doing in global health.
Well, I'll give you an answer from the perspective of extreme heat and hot weather. So there's certainly no doubt that the climate is changing. It's been changing for a while. And a real distinct characteristic of climate change is an increase in the prevalence and duration and intensity of extremely hot days. And so when we get these extended bouts of extreme heat, we know it has a devastating effect on human health and well-being. And the way in which extreme heat and hot weather impacts human health is very different depending on how you look at it across the human lifespan. So it impacts people during pregnancy, increases the risk of stillbirth, increases the risk of premature delivery, impacts children during adolescence because of the ways in which children are at a bit of a disadvantage for keeping cool. Then when we get to adulthood, in the workplace, people are highly exposed to extreme heat, often without the capacity to slow down or to reduce their exposure because of the type of labor conditions they're exposed to. Then as we get into later in life, as we age, there are age-related reductions in the ability to sweat, for example, and that renders older individuals at a greater risk of overheating during extreme heat. And then these things are aggravated by other comorbidities or chronic diseases such as heart disease.
Thanks for asking. This is the fundamental question, why we need to do that. I think it's very important for both adaptation and mitigation, which are the key strategies to respond to climate change. The climate crisis is a health crisis. The WHO has already recognized climate change as the greatest global health threat in the century, which needs greater efforts than the COVID pandemic response.
Welcome to our presentation.
Mainly
climate change.
Climate change.
Climate change.
Climate change.
Did you know that one of the largest carbon dioxide emitters is the healthcare system? In 2023, the global medical carbon emission is approximately 3.7 billion tons. That's around 38,825,000 cars emissions a year.
We wanted to explore what food waste management practices the healthcare system can adopt to improve sustainability and lower greenhouse gas emissions.
Hello everyone, we are group number 5 and this is our project reducing the environmental impacts of antibiotic wastage. This is our team and these are the topics we will be talking about today.
Studies have shown that dengue is the world's most widespread vector-borne disease and has had an increase in endemic potential. This means that a smaller number of mosquitoes can maintain a state of endemicity of disease where dengue is introduced. The World Health Organization reported an increase in cases from 2000 to 2019. With the largest number recorded last year, an astounding 4.5 million cases in the Americas region.
Heat waves create a surge in demand for healthcare services and increase the burden, including ambulance callouts, slower response time, increased emergency and outpatient department visits, increased hospitalization, medicine shortages, and ultimately increased healthcare expenditures.
This year's U21 International Student Challenge, Team 2 brings to you adaptation policies in healthcare in the case of extreme cold weather.
Let us introduce to you telemedicine. Now, what is telemedicine? It basically provides remote healthcare, allowing professionals to diagnose, treat, and follow up with patients digitally. This includes real-time video consultations, remote prescriptions, and secure online messaging between patients and providers.
In conclusion, telemedicine is a sustainable and effective method for enhancing healthcare access in Kenya, thereby addressing both environmental and health disparities.
Today, we'll be presenting real-time climate health surveillance, integrating Internet of Things and electronic health records for resident public health.
Our proposed real-time monitoring system is unique and special because it integrates advanced IoT and remote sensing for continuous environmental data collection. It merges with electronic health records and public health databases to provide insights into climate health impacts. With real-time monitoring, it detects outbreaks early, supporting proactive public health responses for improved public health outcomes.
Let's transform hospital food waste into a sustainable legacy, nurturing both health and environment for generations to come. Thank you to all of our team members for contributing to our project.